We're back, we're live. It is Tuesday. I'm Jay Fidell. To my left, Gerald Ohta. He's the Affirmative Action Officer of the State Department of Health. And Janice Okubo. She's the historian, but also the Public Information Officer. Goes hand in glove.
Actually, Gerald's a historian.
Oh, Gerald's a historian.
Yes.
Unofficial.
Okay, and Janice is the Public Information
That's
Officer.
right, yes.
Okay, and they work with each other.
Yes, we do.
At the State Department of Health. And let's see, we're going to call this the history of public health. It's hot news.
No.
We're going to find out what's going on in public health and how the state handles that, you know. So I guess the first question is, how are you today, Gerald?
Well, we're doing okay, I think.
Yeah, I want you to be healthy, because...
Well, given my condition, I don't know whether that's possible, but we'll try.
Janice, hi.
Hi.
Thank you for coming down to the show.
Oh, you're welcome. Pleasure
Janice
to
and
be
I
here.
worked together on building this show, so it's great to have her here.
Yeah, it's a wonderful collaboration with you.
Yeah,
Yes.
great. So what is public health in the context of the modern island state society? I mean, the thing is, I always say that Hawaii is an isolated place. It's sort of like Singapore. We have to watch out for ourselves. We can't necessarily assume that the people from far away are going to come and bail us out of a problem. So we have to be self-reliant. And nowhere does that appear more clearly than in public health. Yeah. So how does the Department of Health handle public health?
That might be a better question for you, Janice.
Fair question for me. Well, we have a very diverse department which spans across nearly every island. So we have offices all over Oahu, as well as on Kauai, Maui, Big Island. And mainly we look at population health, and we look at trends, health trends, and we try to fill gaps where there are vulnerable populations that need assistance. We try to identify areas where maybe we can equalize things for people, make better health choices available for people, and we emphasize prevention programs, try to address health disparities and health issues that we see coming up for the people who live in Hawaii.
You got to get credit, actually. I mean, because Hawaii is known as one of the healthiest states. Our population lives better and longer. Somebody's doing something right over there. Why is that? Why do we have longevity? Why do we have better public health in Hawaii?
Well, I think a lot of it points to our population makeup. We have an ethnic population that comes from countries that have a history of longevity, and we also have a beautiful environment and a beautiful place to live. We have year-long sunny weather. All those things contribute. But the troubling thing for us in public health is that even with all of that, our population still faces the same similar health trends as they do on the mainland. So while we do have maybe the healthiest people, we also have a trend of obesity that is catching up with us, increasing diabetes rates and other issues. And there are also disparities among some of our populations. Some of our ethnic groups don't fare as well as other ethnic groups.
In fact, the Native Hawaiians are among the worst in terms of the public health statistics for the nation, along with the Native Americans.
Why is that? Diet?
I think it's a myriad of factors, including the effects of colonization and the overtaking of their country and other kinds of
the
things.
culture that they were
Right.
they were built for.
So there's all kinds of issues involved in this, not only diet.
All I can say is I used to ride bike down Kalanianiuli Highway way back when, before the first fast food restaurants were in Hawaii. Everything was okazuya everywhere, which is very healthy, actually. And one day we were riding past Aina Haina, and there it was, McDonald's. And I said to my riding buddy, uh-oh, this is going to change everything. And it did change everything. It was a forerunner of a wave of fast food. Look at us now. Anyway, so okay, then we get from public health to the history of public health. And I offer this thought to you, actually, Gerald. How can you understand, it applies in so many contexts, how can you understand public health if you don't know the history of public health? Or putting it another way, who was it? George Santayana said, if we don't know the history of public health, then we are bound to repeat it.
That's a good paraphrase, I think.
You heard it
not,
here on
not
ThinkTech.
quite, not quite
No,
how I
not quite
remember
exactly
it.
like that.
Yeah, no, we do live in an island state. We are confined in some ways by our own boundaries, the boundaries of land, the boundaries of water, the boundaries of our mind. So those are things that impact upon our health. And then we are in a congested state. I mean, every morning you drive in, you know that. So there are a lot of
Everybody.
different factors that impact on that.
Yeah. I mean, I guess I'd put this back to Janice. You know, we do have good health. I mean, I think that's numerical. It's easy to find the metrics on this, but is it sustainable in Hawaii? Because that traffic eats us.
Yes.
And, you know, we have I think to add to your answer, aloha spirit, that helps us. But to the extent that the aloha spirit may be degrading a little bit over the years, that doesn't help us.
Yes.
And so, is it sustainable? I mean, you have to be thinking about these things if you're interested in maintaining the numbers that we have, which are good.
Yeah, so we do have staff that actually work with the city and county and with state planners to try to develop more walkable communities, areas where people can walk and bike safely. So we do work with them on those types of initiatives. And you really, public health is all about social determinants. So there are other issues such as income, and where you live tells a lot about how your health is going to be. I mean, we've found that there are communities where if they don't have access to a grocery store that sells fresh fruits and vegetables,
They're
they
not
don't
likely to
even
buy fresh fruits and vegetables.
yeah, they don't even have the choice of living healthier. So it's really important that we look at all of those different issues and work with all of the departments within the state and collaborate. So really, the governor's initiative to have departments work together and collaborate, and like our collaboration with you on this show, it's very important that we all contribute and try to work on these determinants.
I have it now. I have this vision. It's Monday morning, okay, there's a cabinet meeting. David Ige sitting at the head of the table, and Virginia Pressler very close to him, okay? And he turns the mic over to her, and she says, "Have all of you had your fresh vegetables today?" The other cabinet members. I mean, really, it has to start somewhere.
Yes, it
And
does.
it's a good place to start from you. But George, I mean, we have a certain ethic here about good health. We care about the diversity. We care about trying to make everyone healthy, have a good quality of life. It's really important in Hawaii. So is this deeply rooted in the history of the place? Did we find this early on? Did we find it in the monarchy, for
Well,
example?
for instance, when Cook, quote unquote, discovered Hawaii, and Hawaiians were already here, they had actually discovered it first, he found very robust people, found a very healthy people, muscular people, tall people. So it's not like there wasn't health before. And so what has happened over time is that when Cook came, he estimated the population at 250,000. Now, some people say it's higher than that. But by 1900, the 250,000 Hawaiians
Decimated.
transformed into 40,000 Hawaiians.
Decimated.
Decimated. Right.
So that was because of the white man's disease from Europe.
And Asian diseases from not so white men in Asia.
Okay, well, everybody
Asia.
had a hand in it.
Yeah, but plus there was not only there was lifestyle changes, there was all kinds of changes. So, but yes, the diseases had a high impact.
Well, I guess you can say that it was a carefully balanced kind of thing, a cultural landscape back then, say at the turn of the 19th century, where everything was in balance, right or wrong, it worked, and with the fish ponds and the taro and all that. But then when you started introducing new influences and disregarding the old ways, that's got to pull the rug out of the balance, and then all of a sudden it wasn't so well balanced. And then when you introduce pathogens to people who may be compromised because of the change in the cultural landscape, then it gets worse. And I don't know the diseases that decimated the population. What were they?
There were actually many, but the ones that come to mind as the sort of marker diseases are smallpox, Hansen's disease or leprosy, bubonic plague. But bubonic plague was more of a late 19th century thing. But all of the usual things came in. Tuberculosis came in the latter part of the century. All the European diseases or diseases from elsewhere were impactful. We even had cholera outbreaks. We had other kinds of outbreaks.
Did we have the medicine to deal with this?
For some of them, actually, in the early days when the first Western doctors came, they actually tried what we were talking about before the show, which was that the fact that they tried to inoculate people against smallpox by using cowpox and other kinds of things. This is in the early 1800s. This is before a lot of other places were doing this.
Yeah, we were talking before the show about George Washington and how he was the first American president to advocate for inoculation. Give him credit for that. So now it comes to the year 1900 or so, and I want to tell you my story. When I began practicing law here in 1971, one of my first cases was the Maui Quarantine Fund. And the problem with the Maui Quarantine Fund, which I didn't tell you, was because it was dedicated in the trust document that created it to the bubonic plague. That was a problem. The merchants on Front Street in Lahaina were trying to avoid the risks of bubonic plague. They thought it'd be bad for the economy. So they put the grand sum total of $10,000 into this fund. This is going to help them deal with any outbreak of bubonic plague from the rats off the ships on Front Street. And there was no bubonic plague at all. Never had a single case. And the $10,000 stayed there, and it earned interest. And by the time I started practicing in 1971, it was worth hundreds of thousands of dollars. And by the terms of the trust, the Maui Quarantine Fund, the trustees could not spend the money because there was no bubonic plague. And it was going to sit there forever. So there's a doctrine in the equity courts, in the probate courts, called si pre, which is French for find another purpose nearby. And the idea was that the court had the power to reform that trust and to identify other diseases they could actually spend the money on. And we went to court in the Second Circuit, and we got the judge to expand the diseases. And I believe that the Maui Quarantine Fund still exists right now, today, but covering other diseases. Isn't that cute?
Yeah.
That's what happened.
When they had the huge Chinatown fire at the turn of the century, 1900 or so, not only, but for those people, that was a death sentence. 61 people died of bubonic plague in that outbreak.
Not 2 blocks from where we sit.
Right, the one that created the Chinatown fire. And actually, it burned almost the entire, from the ocean up to nearly Vineyard. That whole area burned out. But only 61 people died before the plague ran its course in Honolulu. But because of that, they created these war funds and quarantine funds. And as I was mentioning earlier again, that we had the war fund on the Big Island, in which we actually used it for a different purpose other than controlling bubonic plague. But even on Hawaii, we did have a plague unit in place until the latter part of the 20th century.
Well, but it all goes to the historical point.
Yeah.
And that is, Hawaii is an isolated island state, not that close to the mainland or to Asia, had to be self-reliant. We had to see what the risks were. We had to be very conscious of our own health, that we had pathogens coming in from various directions, and we had to protect ourselves. And so we developed a mentality which is now quite visible in the Department of Health to protect ourselves and to make sure that we don't get swept away in some awful, epidemic.
Yeah, it's true enough. The way our department developed is very much part of our history, and certain of our programs actually sort of reflect that.
Yeah. What programs?
Well, for instance, again, rats and mosquitoes were very important. For a long time, like many health departments, we had vector control. Of course, in the last couple administrations, the vector control program was actually eliminated because the feeling was there's enough private sector capacity to take care of the issue. Well, I think we might have some difference of opinion on that, but certainly that was one of those policy decisions is made by the legislature and the governor in terms of how to go with your programs.
Sounds like complacency to me.
Well,
but, yeah.
I'll leave that to someone else.
Okay.
Our public health nursing program started in the settlement houses, like Palama Settlement, and actually transferred to the Department of Health.
That's another element, isn't it? You know, in the days of the plantations, in the days when people had no money, so you lived close to each other. I remember there was a Filipino men's camp in Kohala, which is one building, and for some reason, all the Filipino men were in there, and they must have had all of 3 feet of space for each one, you know, and I'm sure it wasn't a healthy situation. The same with Chinatown. It was not a healthy situation. People living on top of each other, and that, you know, creates disease.
Part of the problem, I think, with the Chinatown experience that we've seen, at least in retrospect, was it was treated using the public health thinking of the time, and fire was one of the ways of eliminating the hazard. But of course, if you think, if a rat sees a fire, are they going to run into the fire? I don't think so. But part of it was the feeling that Chinatown was a congested place where people lived in unhealthy conditions. And part of that, actually, in the current look, is partly racist in terms of how they saw Chinese people.
This ghettoization is what it is.
Yeah.
Yeah, we've had it.
And that's actually happened on the East Coast as well, in the ghettos.
Oh,
there.
sure. Look at the Lower East Side of Manhattan. Same kind of situation. Everybody jammed up against each other, and a lot of illness, a lot of fires in those days. Talking about the late 19th century. Yeah. Well, let's take a break. This is getting pretty intense here. That's Gerald Ohta. He's the affirmative action officer. We have to define that in a minute. And Janice Okubo, she's the public information officer for the State Department of Health. We're talking about the history of public health here. And we have a special history here in Hawaii, the state of health. We'll be right back.
Hi, I'm your host on ThinkTech Asia, Bill Sharp. I look forward to you joining us each Monday between 4 and 5 o'clock when we film right here in our studio in downtown Honolulu. The show, ThinkTech Asia, focuses on contemporary events in Asia. And by Asia, we mean anything from Hawaii, south to Australia and New Zealand, west to Pakistan, and as far north as the Russian Far East. Clearly, this is one of the most economically dynamic centers of the world, and we bring you up to date on what's going on in a whole host of countries in this very vital region. We look forward to seeing you. Aloha.
Dr. Lee was the last.
Inspired by an ancient culture, classical Chinese dance, vigorous physicality, timeless stories, 5,000 years of Chinese music and dance, Shen Yun presents authentic Chinese culture. Coming to Blaisdell Concert Hall, May 8th and 9th. Tickets at shenyun.com or call 808-792-3911.
Okay, we're back. We're live. We're exploring, even during the break, about how it works in Hawaii in public health. Gerald Ohta to my left. He's the affirmative action officer of the State Department of Health, and Janice Okubo, who is the public information officer of the Department of Health. And we're talking about the history of public health. So I think we got to clear the deck on exactly what it is, affirmative action. And you mentioned in the break that a lot of this has to do with access to minority groups and avoiding a racist profiling in terms of providing health.
Well, I wouldn't characterize it quite that way.
Please,
it's
correct
it's what we call equal employment opportunity and equal access to services. And it's not only for minority groups, it's for everyone, hopefully.
Okay.
So that, and in fact, in Hawaii, there is no majority group. So it makes even more sense to make sure that we treat everybody in an equal way, if not equitable, but hopefully equal at least.
So when you say affirmative action officer, you're part of your job anyway is to go out there and find out if people are getting equal access to public health. Yeah?
Correct.
And so your programs are dedicated to doing that.
Hopefully.
How does it work? I mean, how do you find out? You have to go like audit people? Or
Well,
what?
basically, we also monitor and assist our programs in what they do and how they reach people and make sure that they have the information and hopefully the tools that can allow them to access those people better themselves, because we don't provide the services out of Janice's office or my office. It's out of our programs offices,
Okay.
like the nurses, like the people in the clinics, that kind of thing.
Okay, so, but you go and you look and check to make sure that
Yeah.
they're meeting the standards that you're setting for them. Yeah.
If we have time.
Sure, of course, of course. But how does that interplay with the Affordable Care Act, which is supposed to bring, I mean, Hawaii may not need it, but which is supposed to bring public health to everyone?
They have some sections in the law which provides for non-discrimination and equal access. So what they're trying to remind us of, in fact, this is not new, they're trying to remind us that we need to be paying attention to these things to make sure that not only are you trying to deliver health services, but you're trying to make sure that the services are done in a culturally appropriate manner, in a language that the person can understand, because if the person can understand what you're saying to them about their health, how can you expect them to follow?
Well, I'm just making a wild guess, and I'd say that in this state, we have the Micronesians who have come and are coming in by great numbers, who frequently do not know how things work in these United States, and they need help to integrate on many levels. I remember visiting Kealakehe High School in Kona, where the school had classes for the parents on how to go to the supermarket, how to integrate with the community and live reasonable family lives. So the same thing here. I mean, in order to take advantage of health systems, you have to be somewhat educated in health and health systems. And that's the only way some people can actually achieve access.
Many of the people who were born here, who speak English, don't have the knowledge to actively access their own health tools.
This is a big point.
Yeah.
So if you want to make it egalitarian, you've got to educate people. Yeah. How are you going to do that? How are you doing that? Ready, go.
Our various programs, they put together campaigns and educational materials for those groups. And of course, we're always looking at translating materials and how to make them more ethnically appropriate. But really, every program seems to have their own challenges depending upon what service or what they're trying to provide. So immunization might not have the same challenges as injury prevention, but they try to address those groups. So we do health surveys. We also conduct focus groups. We also do research among nonprofits and different types of agencies and ethnic groups. And we do collect a lot of data and a lot of information. And we're always looking for ways to be able to share data and share information with other people so that we can work together to identify and address what issues are out there.
It strikes me that unless you have the data like that, the demographic data, the medical data, just the numbers, you can't know who's getting good access and who's not getting good access. So in order to tackle this problem we're talking about, you really need to have the data somehow.
Yes.
And you got to go out and get it.
Yes, and work with other people to share data to be able to get the best data available. Yeah, so that is a big part of what the department does. We have a lot of staff that's constantly looking at the information that's out there, new information that comes out, where we can obtain data and share data, because we want to do things that are science-based, that are evidence-based, things that are proven to be effective, and to address audiences that we know are dealing with obstacles or issues.
Are we keeping up or ahead or behind of programs like this on the mainland? Do you know? Or are we special? I mean, I would guess we're special because Hawaii is the kind of, it embraces people much more. It embraces the diversity, and we care more about our population.
Well, I think that our population has both advantages and disadvantages. So, we do have that, of course, that advantage of having a large Asian population, which, makes it look like overall our longevity is very long. We have very good health. But the diversity of our ethnic groups and our population makeup does make it more complicated and more for us to identify what the issues are out there. Whereas a lot of other states don't have that type of mix and that type, having to really dig down deep to look for the real causes. So, many times people might look at a problem and believe that there's a simple solution to it, but they haven't really looked deep enough to see what the actual real source of the problem is. And that's what we're always trying to advocate, is really look at what the real problem is, the ultimate problem, as opposed to just putting like a Band-Aid or a patch on it.
Yeah. What's so interesting about the diversity is that the big pharma companies on the mainland love to have our numbers, especially in the oncology department, because they can figure out the effect of drugs on certain groups in the diverse array. And there's a fellow named Greenwood, Dr. Gig Greenwood, who teaches in medical school, who actually specializes in this sort of thing, doing diversity databases on diverse groups and their reactions. And big pharma on the mainland likes to have that information. So yes, I mean, it's more complicated for sure if we have different reactions by different groups to a given treatment or care. But it's also very interesting that we have that data for that, and we can tell you which is more likely to help each individual group.
And we need to be mindful that it may not necessarily be your ethnicity. It may be your geographic location. It may be other kinds of factors that make certain activities more possible or more impossible.
Yeah. So we were talking in the break about the School of Public Health, and when I was much younger, I remember meeting Jerry Michaels, the dean at the time. This was in the 70s, I guess. And now later, I mean, I found that the School of Public Health was merged into John A. Burns School of Medicine as a department there. So what was the origin of the School of Public Health? What was originally intended? What was the reason for the merger? I was sad to see it go because I thought it was great to have it on the campus in Manila, but hey, somebody had an idea.
You want the long story or the short story? The short story is that the school was created to be a center in the Pacific for public health learning. And it actually, I think, fulfilled that pretty well for the first 20, 30 years. But when it came to about 1999 or so, what happened was it, for various reasons, and depends on who you talk to as to what the actual cause was, the school lost its certification.
With a national certifying
accreditation.
organization.
So at that point, it became not a school, it became a program within the School of Medicine. And now it's actually close to being eligible to be a school. The question is whether or not there's the money, political will, and the program strength to make it a school again.
Yeah. But maybe one day. Yeah.
Hopefully soon.
Yeah. Well, what exactly does a School of Public Health do, or Department of Public Health, the case may be, as against a medical school in general? And what is public health compared to health?
Well, I think what Janice pointed out at the very beginning was the focus is not on clinical individual health, but it's more on population health. And it may seem to be a small point because now, because of ACA and other things seem to be the purposes seem to be emerging. But I think there's still a place in which you look at communities rather than at clinical individual people. And so when we think of a doctor, we think of a doctor serving an individual patient. When we think of a clinic, we think of it serving an entire community, even though it may be a conglomeration of doctors. And
isn't this very, very important now? I mean, especially regards epidemiology. I mean, if we had H1N5, I don't know if that's the right
H1N1, I think.
H1N1, serious SARS epidemic here. We want to have every bit of data we could possibly find. And we want to have a regional biosafety laboratory to be able to figure out what we had. And
we already have that, don't we?
We do have a state laboratory.
Yeah, which is the regional place, the regional lab.
Which is it's very, very well managed, and there's a lot of expertise there. So they are very up on much of the testing, and they can train up very quickly to do different types of testing.
They're the regional reference lab.
Yes. So they're hooked up to the national network of laboratories, and they work with the CDC very closely too.
Okay, that's it. So, I mean, we could, we're a destination resort. People come here from all over there, and they don't have to pass by thermometers to come to Hawaii, right? You know, we don't know their body temperature as they walk off the plane. We don't know if they're sick or what. I mean, even Ebola, you know, conceivably, we could have somebody walk off a plane, and we had to be prepared for that.
Yes.
So, I mean, I think it's really great that we're able to get the data, compare the data, and we're able to, you know, refer the pathogen to a laboratory of some kind, and then deal with it on a statewide basis in order to prevent, you know, an epidemic.
Yes.
And I mean, contagious disease is really important. It's really important that we have a good system in place, good surveillance. We're able to monitor and control and prevent contagious disease. But we also have issues with chronic disease and other issues with underage pregnancy, with alcoholism and drug abuse. There are a lot of public health issues, including injury prevention, that our department sort of looks at in order to make sure that we have an overall healthy population.
Yeah, how do you guys sleep at night?
Fitfully. No, one of the things is that our history is such that we had people concerned about health from the get-go, including, and especially the royalty. The royalty was the one that actually created the framework for beginning the Department of Health back in around 1850. And we were the first, if you go back to the kingdom, we're the first state Department of Health, even before Louisiana, which was the first state Department
That
of
is
Health.
something.
Yeah.
I hope you have some certificate on the wall or something to demonstrate that.
I don't think we have a certificate.
We'll
no.
send you a ThinkTech certificate.
Yeah, no, so in other words, the ali'i had this, I think, sense of obligation to their people, that one of the things they had to do was to make sure that the people could be taken care of. In fact, King Kamehameha IV and Queen Emma were famous for walking around the neighborhood collecting funds to start the Queen's Medical Center, what is now the Queen's Medical Center. So all of the ali'i up through Kalakaua and Liliuokalani have had either health or social programs named after them because they've bequeathed them to their people. You know, like
It's a great gift.
Yeah,
Even till today.
yes.
And you feel it. You go to Queens and you feel it, you know. Yeah. Or the others, I wouldn't discriminate. Yeah. So what's the future? Where is this going? Are we going to be safe in the 21st century? What can you do to make us safe? What's the plan to keep us protected against all manner of issues?
Well, you know, you should mention Public Health Week that's coming up.
Oh,
and the
okay.
talk that you guys are doing at the Cancer Center.
We're going to take one more commercial, and then we come back. We're going to talk about Public Health Week.
Okay.
Because it's important. Okay, it's Gerald Ohta to my left. He's the Affirmative Action Officer of the State Department of Health, and Janice Okubo to his left. She is Public Information Officer of the State Department of Health, and we're talking about the history of public health, but it's a history that is still going on here in Hawaii, the state of health and public health. We'll be right back.
Aloha, welcome to ThinkTech Hawaii. My name is Josh Green. I'm the host of a program called Healthcare in Hawaii. I'm a physician. I work in the emergency department on the Big Island. I also serve in the state senate, which, please don't hold that against me, doesn't detract from my television program. We speak about all the big healthcare issues in the state. We get together on Tuesdays from 2 o'clock till 3 o'clock in the afternoon, and we try to talk about the most important issues in healthcare. This is a terrific venue for people to learn about healthcare. There are many programs on this station. We broadcast it later, not just on the internet, but also on OC16. Thanks for joining us. Please be informed healthcare consumers.
Hi, aloha. My name is Chris Leatham, and I host a show called The Economy and You. The show plays every Wednesday at noon, and on my show, I bring on guests who are interested or working in the technology space. And so I'd like you to come and watch the show and learn with me about all the sort of exciting things that we're doing in Hawaii to build and grow our economy ecosystem. So I'd like to say aloha, and I look forward to seeing you on the show. Thank you.
Okay, we're back. We're live. We're here with Gerald Ohta and Janice Okubo of the State Department of Health, talking about the history of public health. So you have a program, a National Public Health Week, coming up soon. What is it?
National Public Health Week is a program sponsored or pushed by the American Public Health Association, the largest public health association in the country. And what it does is every year, the first week of April is National Public Health Week. And this year, the Hawaii Public Health Association, in conjunction with the Department of Health, the Cancer Center of Hawaii, and the John A. Burns School of Medicine, is having an event at the Cancer Center. And Dr. Pressler, our director, will be speaking about new directions for the department. I'll be, again, speaking about history. And Dr. Tom Willis will be talking about e-cigarettes and public policy. And Dr. Claire Townsend will talk about community partnerships and obesity and diabetes. So this is on next week, Thursday,
Oh, coming right
on the
right
9th.
away.
Yeah, so if you're interested, go to hawaiipublichealth.org and sign up.
You have to sign up?
Yeah. you have to
Okay, then you
register.
go. Okay, undoubtedly, Janice, you had something to do with this program. So what would you add, to Gerald's comments?
About the Public Health Week?
Yes.
Well, just that, it's really important that we all know about public health, that public health really is responsible for monitoring and keeping things like our water and air clean for our department. And a lot of things that we do, our staff does. I mean, they work so diligently. They're really, really committed people. A lot of the things they do go practically unseen. So if it weren't for things like your show, we wouldn't be able to talk about these things and make people aware of all the things that we're doing day to day to make sure that we maintain good health in Hawaii.
I want to try to come down there and film some of those remarks.
That would be great, yeah.
Yeah, we can put them on OC16.
Yeah.
Okay, so we have photographs, and we should take a look at them. And if you guys could give us a running narrative of what we're looking at.
Okay, this is a picture of King Kamehameha III, Keokalii, and Queen Kalama. And under the reign of King Kamehameha III, the Board of Health was first established for the port of Honolulu and later extended to all of the kingdom, to all the islands. So we look to him as the beginning of the Department of Health.
Okay.
This picture is interesting because if you look in the background, you see that building with a steeple. That's Kauai Hau Church.
Easy to identify, actually.
Okay, and the woman in the foreground is Kina'u. Kina'u was the Kuhina Nui. Some people say premier. She was in effect the regent, while King Kamehameha III was younger, and she sort of ran the place, if you will. I mean, hopefully I'm not made anybody mad by saying that. So she is the one that we have named our building after, because she is the one, we look at the next slide, that issued what is known as the first written public health measure in the kingdom. And what this does is it notifies captains coming in by ship into the harbor that they cannot anchor, they cannot come in unless they have been declared free of smallpox. So this is 1836.
Would have been great to be there.
Okay, so this picture now is actually fast forward to about 1890. You really can't see it in this picture, but to the right is the Iolani Palace, because in the picture you can actually see the fence, but this one you can't. And to the left would be where you used to be able to get your state ID. And what you see in this horse-drawn contraption is an ambulance. And if you can make out below the roof, you can see this horizontal line. That's a cot hanging from the roof of the carriage, and that's what you would lie on if you were a patient being taken away on this ambulance.
And where would you be going? What was the hospital there in the downtown area? at
Well,
the time?
by that time you would have had Queens.
It would have been Queens,
yeah.
Okay.
Because Queens was in the late 1800s, so you would already have that. This is the Kalihi receiving station, and this is where patients, in this point, we're thinking that it's either TB or still leprosy. But what's interesting about this photo, number one, is you see the vehicle, and you can barely make it out in the picture here. But the men, some of the men are wearing kimono, and some of the women are wearing kimono. So you can tell that this is probably in the early 1900s, given the framework of the technology as well as the people in the picture. This is a 1911 photo, formal studio portrait
They look very military.
Well, actually, they have, you can't really see it easily here, but they have actual metal badges.
Uh-huh.
They are very military in bearing. And these are our mosquito and rat inspectors.
Okay, all right. I wonder if any of them worked on the Maui quarantine.
This is probably a Honolulu photo. I would
Okay.
probably doubt it. Okay, this is a late 1940s photo, maybe a little later than that by looking at the car that you can see a little lower. But it's a dusting plane, and what this plane is doing is spraying DDT.
Ah,
The DDT, of course, we now know is very toxic, is very deadly to wildlife as well as toxic to people. But as you can see, they're flying right over our Department of Health workers in their car.
was there a big problem with mosquitoes in that time?
Yes, there was always a problem with mosquitoes. And in fact, one of our administrators said that his father was the plantation manager in the Western Oahu, and this is probably middle or west lock of Pearl Harbor.
Interesting. We're out of time, you know. We have one more picture. You want to go through that very quickly?
Very
Gerald?
quickly, these are radiological monitoring. They actually are carrying Geiger counters to measure radiation in particular areas.
Oh, interesting. You guys have a great history.
Yes,
It's really
we
wonderful.
do.
And you retain it and you keep it, and you know, it's part of your fabric. I think that's wonderful. That's Gerald Ohta. He is the Affirmative Action Officer and the historian, I get that right, of the State Department of Health. And Janice Okubo, the Public Information Officer that wraps around everything. Here in Hawaii, the State of Health, we've been talking about the history of public health and much more in Hawaii. Thanks for watching. Thank you.
I'm Donna Blanchard, and this is your ThinkTech News for Tuesday, March 31st, 2015. In Switzerland, the deadline to reach a nuclear program accord with Tehran has been extended. Representatives from the United States, Britain, France, Germany, Russia, China, the European Union, and Iran have been powering through the issues and have now extended the deadline until tomorrow. Marie Harf, a State Department spokeswoman, said, "We've made enough progress in the last days to merit staying until Wednesday. There are several difficult issues remaining." Another Western party who asked to not be identified said the negotiations today have been difficult. The only party involved stating he believes the talks have a high chance of producing a deal is Sergei Lavrov of Russia, and he's been away from the table until this morning. He's been attending a meeting with a delegation from Vanuatu, the small Pacific island recently devastated by a cyclone. Lufthansa, parent company of German Wings, is now stating that Andreas Lubitz informed the company that he had suffered a, quote, deep depressive episode in 2009. He offered this information when he reapplied for the airline's flight school after a month-long pause in his studies. Lubitz is the co-pilot who appears to have intentionally crashed German Wings Flight 9525 last Tuesday, killing all 150 people on board. Just when I finally get to say the name Good Luck Jonathan on ThinkTech News, it's to announce that he has lost the Nigerian presidential election. Since 1999, the country has been governed by the People's Democratic Party, but the country has suffered economic decline, inequality, and corruption. The newly elected Muhammadu Buhari is a former general known for ruling with an iron hand. Mr. Buhari won by more than 2 million votes, and some say this victory is more of a repudiation of the current president and past leadership than a vote of confidence for Mr. Buhari. Governor Mike Pence of Indiana gave a press conference today during which he pledged to fix Indiana's controversial religious freedom law. To clarify, it does not allow discrimination against gays and lesbians. However, he also noted the problem isn't the law itself, but how it's being perceived. He said the fix is necessary only because of, quote, frankly, the smear that's been leveled against this law. He said the fix won't involve statewide anti-discrimination protections for LGBT Hoosiers, but went on to say it would be helpful to move legislation this week that makes it clear this law does not give businesses a right to deny services to anyone. Republican contenders for the 2016 presidential nomination, including Jeb Bush, Marco Rubio, and Ted Cruz, have rallied to Pence's defense, while major corporations doing business in Indiana, such as Apple, Walmart, and Salesforce, have criticized the law. And the NCAA, which is set to host the men's basketball Final Four in Indianapolis, threatened to take its business elsewhere in the future. This is a capitalist society, and we consumers have the power to make decisions that our legislators cannot ignore, said Donna Blanchard on the ThinkTech News just now. I'm Donna Blanchard, and this has been your ThinkTech News for Tuesday, March 31st, 2015. Ahui ho!